document how much is in the suction container. And then report after food, reporting quality.
Alright, so I'm going to come up and I'm going to check my orders. And we've got Valerie Jones. Her diagnosis is abdominal pain. She has no known allergies. Her physician is Stones, and it is verified by a physician, the order is. And we have an order to insert an NG tube and connect to intermittent low loss suction. She is NPO status, and we're also going to flush with 50 mLs of water every 8 hours and as needed. So then I'm going to gather up all my supplies. I'm going to come into the room and I'm going to knock. My name's Brooklynn. I'm going to be your nurse today. Can you tell me your name and date of birth? And I'm going to match what she says to her armband and the order. And I'm going to wash my hands and provide for privacy. So, Ms. Jones, do you have any allergies? She's going to tell me no. And I'm going to ask if she's ever had an NG tube before. And if she had not, then I would explain the procedure to her. So I'm putting my gloves on, and then I'm going to raise the bed. So, Ms. Jones, can you tell me, like, what you typically eat in a day? How much do you eat in a day? When you usually have a bowel movement? I'll just ask her some questions for the GI assessment. And lay her head down. Alright. I'm just going to pull the covers back. And first I'm going to inspect, so I'm just looking for any striae, which is stretch marks, any like scars, pulsing masses, anything like that, which I don't notice, so she's good. So then I'm going to auscultate. So I'm going to listen for bowel sounds in all 4 quadrants. If I don't hear any bowel sounds, I will listen for a full 5 minutes in each quadrant.
And I'm going to go ahead and wash my hands again because we took your energy out. And make sure there's privacy. Your bed is already raised.
Bowel sounds are present, so then I'm going to listen for a bruit in the epigastric region.
So I'm going to compare my order.
Alright, cool. And everything's within defined limits. There was no bruit noted. So I'm just going to put this back on. And then I'm going to palpate, and I'm going to go in the same direction that I auscultated. So I'm just checking for any like tenderness. I'm watching her facial expressions and vital signs. I'm checking to see if she has any rebound tenderness, which she does not, so she's good. So I'm going to cover her back up. And I'm going to raise the head of the bed. And make sure she has a pillow behind her neck to support her head. Alright, and then I'm going to check gag reflexes, which she has. And then I'm also going to check the patency of her nares. So I'm going to have her breathe. Breathe. I'm going to check inside. Have you ever had a broken nose or deviated septum? She tells me no, so we're good to go. So, alright. So this is going to be just a little bit uncomfortable, but hopefully it'll get you feeling better. So I'm going to open up my NG tube. And I'm going to go ahead and educate my patient that after the procedure, she's going to be on NPO status, and she has to keep the head of her bed elevated to above 30 degrees. So Ms. Jones, you cannot eat anything or drink anything afterwards, and make sure to keep your head elevated. And then I'm going to measure the NG tube. So first I'm going to get some tape.
I'm going to check the pH. It's supposed to be acidic. Now I'm going to go ahead and return those off and back into the stomach. and her
Okay.
resistance were.
So I've got my tape ready, so I'm gonna go ahead and measure. So from the tip of the nair
I'm gonna go
to
ahead
the
and turn
earlobe,
top of,
down to the xiphoid process.
and I'm gonna check the instructions again. 1 can, 1.5 calories.
And we're getting 56.
Head to.
So I'm just gonna tape it off at 56.
And it's not expired.
So we know where to insert it to.
Right.
Alright. And then I would lube the tip of this, and I'm gonna go ahead and spray this in their nose to make it a little bit easier on them. Alright. I'm gonna put the drape on her.
And I'm not gonna hold it too high, keep it low, don't just go on too fast. Get it in, this is all in there.
Alright, and I'm gonna give her the cup of water and tell her to swallow as I'm inserting.
Squeeze it.
Alright, Miss Jones, so I'm gonna insert. So just every time I tell you to swallow, take a big gulp. Alright, so swallow, 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 and which I would go to 55, but it's not in this mannequin. So now I'm going to tape it to her face so it doesn't slip out.
Ask if she's feeling okay, if she's having discomfort, any pain. Looks like her feeding went well. I'm gonna date, make sure everything's date and time initial.
Alright, I'm gonna go ahead and get another piece of tape just to make sure that
I'm gonna
stays.
document how she tolerated it, what I did. And how the dressing looked. I'm gonna,
Alright, and I'm gonna tape it to the gown.
Patrick should be leading there. And she is gonna stay head of bed at least 30 degrees.
Alright, I'm gonna move this. Alright, and I'm going to listen to her breath sounds. Alright, her breath sounds are clear bilaterally. She's doing good. She tolerated the procedure well. If she was coughing while I was like inserting that, I would stop, because it could possibly go into her lungs. So then I'm gonna pin it to her gown. And I'm going to make sure that it's not coiled in the back of her throat. Oh. And I'm going to call for x-ray. So x-ray times, they pick her up. It is in the correct placement. They bring her back. So I've already educated my patient and everything. So I have new gloves on. I've identified my patient. And now I'm going to flush. So we're going to get this out. It's kind of stuck. And I would date, time, and initial both of these and fill this with this water. So I'm gonna get the tube. And I'm gonna get 50 mLs of water that is by our order. Unclamp, flush, and then pull it back out. And then stick that back in here. And then I'm gonna hook it to low wall suction. So we're just gonna hook it up, set it right there, and I'm gonna turn it on to low wall. And I'm also gonna note on the intakes and outputs that that 50 mLs that I just flushed with is gonna go into that canister. So then I'm going to remove my gloves. And I'm going to lower the bed. I've already educated my patient. She understands everything. So I will lower the bed, wash my hands, provide for privacy, and document. And then we've got another order, so I come back in the room, wash my hands. I've already identified my patient, introduced myself, explained the procedure. So I'm gonna put gloves on. And we have an order to discontinue. So we've checked the order. We've matched our patient and everything, she's good to go. So first I'm gonna unhook this, all right? and then I would have a towel so like the contents of this didn't go everywhere. But I'm gonna let that canister suck this back up into there so everything gets in. All right, and then I would turn it off and I would measure the output on there and make sure to chart that later. So make a note of that. And then I'm gonna go ahead and unpin this. I'm gonna untape it. All right, Miss Jones, so we're gonna take this out. So I take it out in one swift motion, so we're just gonna pull. All right, and then I'm going to wad this up into my glove
I'll have to edit that one.
and put it into a biohazard bag. So we put that in there, and I have washed my hands. So then I'm gonna cover the patient back up, make sure she has her call light. I would lower my bed back down, and document, provide for privacy, document, make sure she has everything. So then we're gonna come back into the room. I've already identified, I've already washed my hands, provided for privacy, and I'm gonna check my orders. All right, so let's see. We're gonna give 1 can of Jevity every 4 hours per peg tube, flush with 50 mLs of water after each bolus feeding. And we're also gonna check the gastric residual every 4 hours. And we're gonna hold the feeding and notify the physician if it's greater than 150 mLs. So we have the correct patient and everything. So I've already washed my hands. I'm gonna put on gloves. And I'm gonna go ahead and make sure that my Jevity is not expired. And it is not. So that's good to go whenever we're ready. All right, Miss Jones, so I'm gonna raise the bed. And first I'm going to inspect the peg tube. So I'm looking for signs of infection. So I don't see any drainage, no redness. It's not like too warm or anything. She doesn't note any pain or anything, so it looks good. So then I'm going to check my residual. So to check my residual, I'm gonna take this and I'm gonna kink it and uncap it. And then I'm gonna take this and I'm gonna squeeze it and put it in and then unkink and let it fill up. All right, and then I'm gonna kink it out and put it into here. And I would continue to do this, I would repeat this step until I noticed that it was done. So this would be full and there would be bubbles, so we're gonna do it one more time. So we got it kinked, squeeze, put it in, unkink, let go. Let's fill it up. I see that it's bubbling, so I know that it's finished, so I'm gonna kink it back off, undo it, and put it into here. Alright, so then I'm gonna put the cap back on. Alright, so I'm gonna measure the residual, so I'm gonna make sure it's not greater than 150, which it is not, it is 100. And I'm also going to check the pH. So we're gonna take the strip. I'm gonna stick it in there. I'm gonna match it to the color, and it is within the defined limits because we know that gastric secretions are gonna be acidic, and it is acidic. So then I would make sure to note that so I could chart it. All right, so then I'm gonna put the residual back. So we're gonna uncover the patient. Do that, it's kinked.
You can kind of.
So I'm gonna take my bulb syringe, I'm gonna squeeze that up in there, and then I'm gonna connect it, unkink, and squirt it back in, and then kink it, unconnect it, get the rest, put it in, unkink, squirt it back in, kink it, and disconnect. And I would do that until I was finished, which I am. We do not have any residual left. So then I'm gonna put that back on, clamp that.
Oh, I see what I did. It went all together.
All right, so the residuals returned. So now we're gonna do the feeding. If I wasn't doing a feeding, then I would go ahead and flush with 50 mLs, but we don't need to do that because we're gonna do it after the feeding. So we've got our Jevity. We already checked, it's not expired. We have cleaned it with an alcohol swab. I'm gonna take the bulb syringe. I'm gonna take this off. And then we're gonna undo this. put it in. And if the patient started like cramping or anything as I was pouring this in, I would make sure to lower it. So we're just gonna pour it in, pour all of it. All right, good. So then once it's poured in, I'm gonna kink it, undo, and put the cap back on. And then I'm gonna put the bulb syringe back on, or the bulb back on the syringe, and then put it back in here. We're done with that. So now that we've given the feeding, we're going to flush. So I'm gonna open that back up, open this back up, it's kinked. We're gonna get 50 mLs as by our order.
And then you can add the other one to this one,
Hook
right?
it up.
So it can just be one.
Unkink,
big-
flush, kink it,
Okay.
take it back off,
Okay.
put it back
It
in here.
was right here where I just started, I just
So
cut
then
that
I'm gonna
end
put
off.
this
Okay.
back up,
Okay.
If you're okay with that, and I'll
I'm
send it
good.
to
when
you.
she is ready to go.
Okay.
And this was already filled with water, but you know, if it had been over 24 hours or anything, I would always make sure to get new water. It's all daytime and initial and everything, so I know it was good.
I don't know if she can hear.
So then I'm going to remove my
I think
gloves.
I talked about it.
I'm gonna roll it in. I'm gonna make sure that she's okay. She doesn't need anything. She has her call light. I would provide for privacy, wash my hands, and document. All right, so now I'm gonna open this up.
She said.
That's my tape.
Spin on the other, you can flip on.
I'm gonna go get the cleaner real quick.